Yesterday, the Prime Minister couldn't answer whether the government negotiated the right to manufacture vaccines here in Canada. At committee, the head of the Public Health Agency suggested the government did not do that. So let's try this one more time, Mr. Speaker. Did the government negotiate the right to manufacture vaccines here in Canada? Yes or no?
Honourable Parliamentary Secretary.
Mr. Speaker, and when this pandemic began, we all know that Canada had no biomanufacturing capacity suitable for a COVID-19 vaccine. Underinvestment in vaccine production capacity began decades ago, in the previous century. And we realized right away that we had to invest in our flexible domestic production. We had to ramp up our facilities, which is exactly what we did. But rest assured that when a vaccine is ready and approved, we will be one of the first countries to get those doses from the manufacturers of Canada's vaccine portfolio.
Well, Leader of the Opposition.
Mr. Speaker, you know there's no plan when the Minister of Health is here and not answering questions on a pandemic, Mr. Speaker. It's rubbish. In fact, rubbish was the word one of the experts used to provide on the government's answer to vaccine manufacturing. The National Research Council has a facility in Montreal that could manufacture millions of vaccines. We know that most of the world will receive the vaccine before Canadians do. Why did the Prime Minister negotiate deals to put Canada at the back of the line for COVID-19 vaccines?
Before we go to the Minister of Health, order. Before we go to the Minister of Health, I want to remind the honourable members that we are not to state whether someone is present or not. It's just part of the rules, and I am here to enforce them. The Honourable Minister of Health.
Well, thank you very much, Mr. Speaker, and I think the member opposite it fails to understand that, in fact, Canada is the best country positioned with the most doses of vaccine per capita anywhere else in the world. In fact, we have 7 leading candidates that we have procured, Mr. Speaker, 3 of them under regulatory review. In fact, you know what, Mr. Speaker, we're the only country that is reviewing all 3 leading candidates right now as we speak. In fact, Moderna, if he won't listen to me, how about the president of Moderna, who said Canada is certainly one of the first countries to have an agreement with us and will be serviced very quickly.
The Leader of the Opposition.
Mr. Speaker, the robust portfolio they talk about ensures that Canadians will have the most vaccines in 2023, Mr. Speaker. Last night, the Minister for Intergovernmental Affairs gave 3 answers to the same question about when vaccines would be arriving. First, it was January. Then he said sometime in 2021. Then it was the first quarter, Mr. Speaker. In one interview, Canadians saw that the Liberal government has no plan when it comes to a vaccine rollout for Canadians. The question to the minister is simple. On what exact date will the vaccine for Canadians be here?
The Honourable Minister.
Mr. Speaker, the member opposite is trying to confuse Canadians right now as we speak. In fact, what we know here on this side of the House is that we have worked incredibly hard as a government to procure 7 leading vaccines, Mr. Speaker, more per capita than any other country in the world. In fact, Mr. Speaker, 3 of them under regulatory review right now, the only country in the world to have those 3 simultaneously reviewed. I have to say, Mr. Speaker, the future looks bright for Canadians, and I am proud of the work of my colleagues to make this happen.
Yesterday, the Prime Minister blamed the Conservatives for the fact that Canada can no longer produce vaccines. Well, it's not a surprise for anyone that Conservatives let down Canadians when it came to healthcare. But what does the Prime Minister have to say about 2015, 2016, 2017, 2018, 2019, and this year? Why is the Prime Minister making Canadians wait for a vaccine?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. In contrast to the other side, our government has been aggressively pursuing new biomanufacturing capacity. We've taken serious action since well before the pandemic. In our first mandate, we restored the ability for ISED to invest in life sciences that had been pulled back by the previous government. And we've only accelerated our investments significantly since the pandemic with major investments in our manufacturing capacity, Medicago, the National Research Centre in Montreal. We're on our way to building a beautiful portfolio of vaccines. It will be delivered when Health Canada says they're ready.
Well, the minister talked about working with the provinces, but hours ago, the Ontario Health Minister said that that province is no longer expecting delivery of any vaccine in early 2021. Wow. On Friday, the government tabled projections that showed that 2,000 people roughly per month will die of COVID as we move forward. So in April, will the minister have to stand here and apologize to the families of 8,000 Canadians for the fact that they died because she couldn't roll this vaccine out?
The Honourable Minister.
Mr. Speaker, do you know what will help save Canadians' lives? If the member opposite and the Leader of the Opposition stop their members from sharing fake and dangerous news like the member from Lethbridge, the member from Carleton will stay focused on saving lives of Canadians instead of spreading conspiracy theories. And in fact, the member from Nose Hill is focused on keeping us together rather than pitting us apart, because you know what the virus thrives on, Mr. Speaker? It thrives on us working at opposite ends. We need to work together. We need to stay together. We need to support provinces, territories, and indeed Canadians, and that's exactly what this government has done since day one.
Honourable member for Calgary, Nose Hill.
Mr. Speaker, that answer, when Canadians are looking for a plan on when they're going to get a vaccine, will be remembered as desperate political flailing. The question that I asked is one that's on the minds of every Canadian. It's at the heart of the mental health crisis in this country. It's at the heart of jobs lost in this country. It's at the heart of separated families in this country. I ask again, I beg her, when is she going to tell Canadians when they're going to produce a vaccine, give it to Canadians? Again, will she have to stand here in April and apologize to the families of 8,000 dead Canadians?
The Honourable Minister.
Mr. Speaker, my heart goes out to my heart goes out to all Canadians who have lost a loved one to COVID-19, and our hearts break for them. But I'll tell you what, we are going to continue to work day and night to protect Canadians from contracting COVID-19 and from spreading COVID-19. The vaccines indeed are a light at the end of the tunnel, and we're working across government to make sure that we have access to the vaccines, that we can deploy them. But in the meantime, Mr. Speaker, I call on all Canadians to do everything we can together, because we know that collective action is going to protect our lives.
L'honorable député de Beauport-Limoilou.
Monsieur le Président.
Je m'excuse, je vais l'interrompre, l'honorable député. On va recommencer l'horloge.
Super job.
Okay, fine. Thank you.
Mr. Speaker, tempers are flaring in the Commons today because we're in the second wave of a pandemic. People are getting sick. Businesses are struggling, and Canadians are seeing millions of citizens of other countries getting vaccines in the coming days and weeks, and this government won't even answer a question on when we will see them in Canada. They talk about a Team Canada approach, but let's remember, Mr. Speaker, when we asked in January about flights from China, they called us intolerant. When we asked about masks, they said masks weren't important. When we pushed for rapid tests, they blamed the provinces. Now we ask about vaccines, they say we're reviewing, not receiving. When are Canadians going to see the first vaccine?
The Honourable Minister. The Honourable Minister.
Mr. Speaker, our main goal is to get safe and effective vaccines to every Canadian. We are currently in line with Japan, New Zealand, Australia, and the EU for vaccine delivery. And in fact, we have secured a contract with Moderna, one of the most promising candidates, while the UK only secured its agreement last week. We have the most diverse portfolio in the world, Mr. Speaker. We are working very closely with Health Canada in terms of the regulatory process, and when a vaccine is ready, we will be ready too.